Hello, everybody. My name is Dr. Emery Pitcel. I am the owner and chiropractor of Rothrock Chiropractic and Rehabilitation. Thank you for joining us on our channel today. And we are going over, for this month of April 2025, our series that we call Condition of the Month. And this month we decided to highlight tennis elbow because it's April, the weather's starting to get nicer. Maybe some people are going to go out and start doing a little bit more golfing and a little more tennis, for the namesake of tennis elbow, right? We figured this would be a valuable piece of information to highlight for patients and for people that are looking into possibly feeling better with chiropractic care and with muscle work. So the first thing to start with is an anatomical presentation on what is tennis elbow and where is the pain. So with our anatomical position, people sometimes don't realize this is it's actually supposed to be the arms open like this. So therefore the outside of the elbow is actually this part of the elbow and the inside is here. Usually people will stand a little bit more like this and that makes this feel like the inside and that feel like the back. But the anatomical position is here where this becomes the outside of the elbow. Now that is important because a lot of our information and a lot of what we'll keep referencing is the lateral aspect of the elbow and the outside of the elbow. So, anatomy lesson. For this, I'm going to solicit the help of Frank Netter's Atlas here, and we're going to go right to the reference material, and this is the anatomy at the lateral elbow. Now, what you're seeing right here is this is actually that outside of the elbow that we were just talking about, and here's the inside of the elbow, and this lateral epicondyle is the anatomical structure, that bony prominence that lives there. And as you can see, there's all these muscle bellies that come and attach on there. So there's the extensor carpi radialis longus, and the extensor carpi radialis brevis, and the extensor digitorums come and they make their attachment onto that part of the elbow as well. So if all of these get a little inflamed, irritated, or injured, that is where the injury originates from, and that's where the problem starts to come into play. So that is kind of the anatomy right there, where all those muscle groups and tendon groups that move the wrist and move the hand are making their attachment point right there. What are the symptoms that we're going to see that tip somebody off that they might have tennis elbow? Well, in that exact area on the outside of the elbow, there might be stabbing, shooting, or a burning type of sensation, especially with movements and activities, but it could continue to burn and bother at rest as well too. And sometimes if it gets bad enough, those symptoms will start to radiate down the forearm, typically this back part of the forearm, and sometimes even into the fingers and the hands, into that part of the presentation there. Um, it can get bad enough that you start to get numbness around the elbow and numbness into the back of the hand as well too. That's definitely a more progressed version of tennis elbow if we start to see that. Activities and functions that are going to be held up and limited while having a tennis elbow problem are definitely going to be like twisting a doorknob. Think of somebody trying to twist and screw a screwdriver. That's going to be problematic. Somebody that goes to pick up something heavy, like holding onto a gallon of milk, can really hurt right into that spot there as well too. Or giving someone a handshake, as an introduction or at a greeting at church or something, can definitely create some pain right there in that lateral epicondyle for the tennis elbow. And then just in general, you're going to be able to feel right over that and feel like, man, it's like really tender. It could be swollen at points. You could have first thing in the morning where that elbow is extremely stiff and hard to straighten out. And certainly, once again, if it gets really progressed, there could be weakness in the wrist and weakness in the hands. So that kind of covers the symptoms that we see. What is the cause of a tennis elbow? Well, the most frequent cause is going to be repetitive movements, especially repetitive movements related to occupational work. So on this, we're going to pick on somebody like a carpenter that does a lot of hammering and a lot of screwdriver work and a lot of kind of like fine tuning and using of the hands. Certainly construction or machinery work where it's a lot of that same repetitive movement is just going to continue to load and load and load that lateral elbow and not give it a chance to get a breather and a break. We also have desk workers aren't immune either. They could be spending a lot of time clicking and working on a mouse and on the keyboard. And if that elbow position or that arm isn't quite supported correctly, that extensor group could end up taking a lot of the load and generate pain into that area as well too. Sports, the namesake, tennis elbow. There's certainly going to be tennis elbow cases as related to sports. Typically, it's thinking that backhand and that overuse of that muscle group right there. Golfers could certainly get this too. We can get throwing athletes as well too, like baseball players on their follow through could snap down on that elbow and create a tennis elbow type problem as well too. And the last one we want to pick on is trauma, right? Um, think maybe like a hockey player that maybe takes a puck directly to the elbow, or it could be like we fall and we land on the elbow, or just sometimes there's those accidents of we're walking and we cut a corner a little too tight and smack our elbow on the corner of the wall. All of these could be reasonable causes of tennis elbow, but typically it's going to be a repetitive or an overuse type issue. So that kind of highlights the anatomy, that highlights the symptomatology, that highlights the mechanisms of injury. So that's all the doom and gloom side. Let's go over to the side of how are we going to fix this? How do we make it better? At Rothrock Chiropractic and Rehabilitation, we always start with a rehab first approach. We're going to go into physical medicine and home rehab exercises. We're going to start with the McKenzie Method. What we typically find with a tennis elbow is it could generally be classified as one of two problems. It's either going to be considered a derangement, in which case it's going to respond really well to repetitive movement exercise. Most frequently at that elbow, it's going to be extension. Extension with possibly either pronation or extension needing supination at the elbow. But one of those two repetitive movements are going to help clean up that elbow. However, if it's instead we find that we can classify as a contractile dysfunction instead, then we're still going to do like a repetitive movement, but we're going to do that repetitive movement with weight instead to kind of tax that muscle tendon group in an eccentric fashion to rehab up that elbow. And that kind of gets us into the second point is when we start to stabilize out that pain, we're going to focus on strengthening, especially strengthening through an eccentric style. So using like wrist drop to slowly drop like 10 to 15 to 20 pounds to really remodel and strengthen and stabilize out those extensor muscles so they're not overactive and inflaming up the lateral epicondyle. So that's pretty much the rehab approach that we take. We always kind of put our mind in that arena first, but then people are coming to our office and they're coming for more care than just learning how to do stretches and exercises to help themselves at home. Certainly, the stuff we do with the therapy side on the table is extremely beneficial. Starting with the muscle therapy, we love to do a lot of pinning and stretching at that group. You're probably going to have like knots and adhesions and hot trigger points that need to be released in that extensor compartment off of the lateral epicondyle. So like kind of straightening out the elbow and dropping the wrist and really using a thumb contact to strip through the muscle to get that blood flow and neurological reset and rehab the tendon is massive. We'll also like to go through if we find like a really troublesome knot, then to do like those 5 to 10 second heavy releases while a patient breathes through, which we call trigger point release, extremely beneficial to work through for that compartment. And of course, adjusting too. We don't just go after the muscle, we also have to reset the joint kinematics as well too. So there are elbow adjustments, just like the repetitive movement exercise is frequently going to be some variation of elbow opening. We also help the patient get an adjustment to really open up that elbow as well too. And it's also usually wise to go back and do some sort of stabilization work at the cervical spine and the thoracic spine because we just so frequently find that all those nerve roots that comprise the brachial plexus and go in and innervate everything in the arm start from the lower neck and that very upper part of the back. So it's just beneficial to make sure that that nerve chain is cleaned up. And, you know, it's also just reasonable to think somebody hurts at the tennis elbow, they're compensating and changing the way they move in their upper back. It's good to make sure that the neck and the upper thoracic is being protected through all of that. So hopefully that was a pretty good overview of our condition of the month for tennis elbow for our April of 2025 series. This is Rothrock Chiropractic and Rehabilitation, and I am Dr. Emery Pitcel. If you found this video to be beneficial, whether it was like informative or you are struggling with this and you found some of the information here to be helpful and reassuring, please leave us a comment, like the video, subscribe to the channel if you want to see more content like this. If you definitely are having some sort of problem like this or have a family, friend, or colleague that is, send in a referral and a recommendation. We'd be happy to look this over and get you feeling the way that you deserve to be feeling. But from April and for this month, we are going to wrap this all up for today. I am Dr. Emery Pitcel, Rothrock Chiropractic and Rehabilitation. Thank you so much for joining us. Take care till next time, everybody.